Okay, so we're trying to look at anti-cancer cells, anti-cancer drugs, sorry. So these anti-cancer drugs, we're trying to look at what, the cancer cell is growing without any checks and balances. Do you understand? So on that basis, there are some anti-cancer, like the cell is just growing. There are some various checks and balances in the cell cycle, but the cancer cell is just growing without any checks and balances. So you are trying to what? Give a drug that will basically pause the activities of that cancer cell. Do you understand? So we'll look at examples of drugs and look at various places where they act at the cell cycle. So cancer drugs, they target different phases of cell cycle just to disrupt tumor growth and proliferation. So the cell cycle and drug action is at the G1. Now this is an image that is highly a summary of the lecture I'm talking about. Now this is G1. Now at G1 you have the CDK inhibitors. They block cycling dependent kinases, so they prevent the cell from going to the S phase. So examples of drugs, you have drugs like what? Palbociclib, ribociclib, abemaciclib. All of them we're talking about their pharmacology. Then the S phase, that's the DNA synthesis. These ones, they stop DNA synthesis. So sometimes you see that I have just little examples here, but looking at this picture, there's a whole lot of examples. You understand? So for the S phase, we have things like what? They mimic metabolite, they disrupt the DNA replication. So stuff like what? Methotrexate, fluorouracil, cytarabine. Okay. So here too you can have a summary of that. So this one is best. I think the first image is kind of like crowded. So this one is very good. It's very sweet, very neat, scanty for you to grab quick. So the G2 phase now, this one, they prevent DNA unwinding, leading to what? Replication errors. So examples of drugs like what? G2, etoposide, where if you don't see good information here, you can always come back to the first image. Okay, so you see that G2 have what? All those etoposide, teniposide, bleomycin. Right. The M phase, this one, they disrupt spindle formation, preventing cell division. Examples is what? Paclitaxel, vincristine, vinblastine. So checkpoints target is basically, this is a summary of it. Right, this is a summary of it, but it's not a big thing that needs summary. Okay, so guys, that's it for the different cancer drugs and different levels they act in the cell cycle.